So we had a man who had metastatic castrate-resistant prostate cancer who had been doing very well, receiving a sort of standard line treatment with with hormonal therapy. He had received an LH-RH agonist, or a luteinizing releasing hormone agonist, as well as a second generation anti-androgen receptor blocker. And he had been doing fairly well. Then we noticed that his prostate-specific antigen, or PSA, level began to rise, and he had progression of disease. At the same time, he was complaining of some difficulty with his eye. It started to swell. He was a man who had many seasonal allergies and some food allergies, and we attributed to that for some time. But then we sent him to an ophthalmologist, and it was later found that he had a non-Hodgkin's lymphoma that was showing up in the orbital area of his eye. So he began treatment with Rituximab and other chemotherapy regimen, and during that treatment his lymphoma went into remission, but we also noticed that his PSA level went down to nearly undetectable, and disease remission for his prostate cancer occurred. So this seemed somewhat unlikely due to the fact that his castrate-resistant prostate cancer drug therapy was not working well, but now we gave him a drug that we usually use in lymphoma for his lymphoma, and that seemed to work very well. Since that time, he unfortunately has progressed with his prostate cancer, but we did see a good response during that period of time. There have not been any other cases reported, but there are some trials ongoing looking at Rituximab at the time that we published the case report.